Elbow problems, golfer's elbow, tennis elbow, and so on are big problems, especially in the world of calisthenics, because a lot of our exercises use the arm through big ranges of motion, which is great for mobility and for building up the muscles in your chest, back, and of course in your arms. But it also can place potentially a lot of stress on your elbows, resulting in those problems. Personally, I've had a ton of issues with my elbows over the years, especially when I started off in calisthenics, but thankfully, those issues are pretty much in my past and I don't expect them to come back anytime soon, and I'm going to show you how I did it in today's video. Your elbows, like the rest of your joints, are incredibly strong and resilient. They can handle a ton of force as long as that force going through the joint is in a balanced alignment. When we have a misalignment of force in the joint, that's when we have problems. Unfortunately, our modern lifestyles are kind of setting us up for misalignment right out of the bat because we're up and forward with our shoulders. We're a little kyphotic. Our back is usually weak. It's not very turned on very much. So as a result, our arms slightly rotate. When we start doing our exercises with a little bit less support in the back of our muscles and our arms are being used in more of a kind of a frontal plane type of motion, which can put a lot more stress on those elbows, not to mention also in the wrist and in the shoulder. So one of the best ways to fix this is to reestablish a lot of support in your back. I'm always giving you this exercise, right? Shoulders down and back, clasping your hands back. The new version of this is to actually move. So clasping your hands down and back, tense your shoulders, tense your chest rather. Shoulders are up and forward, so you're making yourself purposely go into this kyphotic posture, and then use your back and your lats to pull it back. I'm not trying to pull with my hands. I'm pulling with my back muscles. And I go forward and back, forward and back. Do this as much as you possibly can every single day. I started doing these kinds of exercises about 18 months ago, and I'm still finding it's making a progressive difference in my pull-ups, dips, and push-ups, not just making them stronger, but it's taking all the stress and sucking that right out of the joints. Now, if you already have these issues, be patient. Tendon and ligament issues take forever to heal. In some cases, I've even seen as much as over a year to fully heal those kinds of things because those joints and those tissues just don't get a lot of blood flow in them, and blood flow heals. So if you are struggling from this, I recommend get it checked out by a doctor, just to make sure nothing else is going terribly wrong, because it can be a very serious chronic injury at some degree. And B, get a lot of movement in that area every single day. Do very light, high repetition exercises, nothing that's gonna cause pain, to speed up blood flow in those areas. You can also try heating pads to speed up blood flow, because the more blood you get into that, the faster it will heal. And lastly, if you are doing pressing and pulling movements, try to go with more of a bit of a neutral grip with that. Typically, that makes it not just easier on the joints, but it makes it also easier for you to play around with this rotation and setting of support in your back muscles during your exercises, so you can learn how to keep the tension in your back, the back of your shoulders, and have a neutral rotation in your arms, so that will not only decrease the stress in all of your joints, but increase the working of your muscles. I hope that helps you out. Let me know if you have questions down below. Check out these videos for more, and subscribe here if you're new and you like these kinds of videos. Till then, be fit, live free.